Dr. Blessing, you're on mute.
Oh, there we go. I am, I turn it off and then I forget to turn it back on when I hear your voice. I'm doing really, really good.
Awesome.
Um, what can I say? I'm 4 days from leaving to go on vacation.
Yay.
I'll be on vacation next Tuesday, but I will be joining and broadcasting from my location where I'm at, where I will
Yay.
be at. So I'm not going to be on vacation from this group, because you all give me joy. So, this is not, I don't want to take a vacation from this. Okay.
All
But
right.
I'm doing fine. I'm doing really good.
That's good.
So we've got a number of, oh, you know what? Okay. I thought it was some new people in the house, but it's just maybe some new names. But it's nice to see Justin is here, Dr. RV is here, Rashida's here, Patricia from London is here, Christy is here, Sheila. That seems like a new. I don't know. She might have been here. Sheila might have. You might have been here before. Sheila, are you new? Miss Sheila, want to unmute and say hello to us? Are we a new person? Okay, she's not on, and her camera's not on. And Nia is here. So I am glad to see everyone. And we asked that question. How are you? And I remember the very beginning of this pandemic, we did a whole thing around. We did a whole story and talk about that simple question: How are you? And particularly now, as we are entering into the second or entering the third year of this pandemic, actually, I guess starting March 1st. Um, this is a chronic, long-term stressor, and it's very important to be very intentional about asking that question, how are you? So I pair that usually with, have you been getting enough water? Did you get enough sunshine? Have you been eating healthy foods? Because a lot of us have been snacking a lot and got that COVID-19 extra pounds, or some of us 20, 25 extra pounds.
Oh, yeah, that's where I'm at. I'm in that realm, like 25.
Girl, me too. Me too. Okay, I started off so good at the beginning of this pandemic, exercising and walking and doing all that. And I said, it snuck up on me, girl. And I realized that late night, getting those late night cookies and ice cream, even they have caught up with, it's so easy to put those pounds on and so hard to take
Easy.
off,
OMG.
you know. But I'm going to be back on it. So, excited about that. Hello, Sharon. It's nice to see you back. Yeah. See you back with us. Um, so yeah, so we ask that question. It's important to just not just ask it in a way that's, because usually you say, "Oh, how you doing?" And people usually respond with, "Okay, I'm fine," and you keep on going. Whereas sometimes it's really good to especially with your friends and your close coworkers to say, "No, how are you?" To really listen intently. I found it helpful in meetings because you never know. People might be going through stuff and you just never know it. And they may be coming into a meeting concerned or worried about something else that's happening in their life. And it's important to be able to give that person grace and perhaps even permission to, like, look, go take care of your family, and to be that kind of gracious person with them. That actually happened to me today. A person that I was supposed to have a meeting with, we started with the, how are you? And I started with I don't want the perfunctory, oh, I'm doing fine, I'm doing fine. And this one woman acknowledged that her mother-in-law was uh, had taken a turn for the worse. She was already ill. Her mother-in-law has pancreatic cancer, and that they were thinking that this might be, she may be passing soon, making her transition soon. And I said, okay, well, you know what? Go take care of your husband. It's his mother. The last thing you need to do is be thinking about us and thinking about work and go take care, go get off this call and go take care of your family. She was so relieved to hear that because you just never know what people are, what people are dealing with. Hi, Barbara and Effie. Okay, and
Hi.
there's
Hi.
hi, hi, and there's someone named Tess that's on the line today. Okay, Tess, whoever you are, it may be Tess Run. Okay. Um, so when we ask that question, how are you? Let's make that a lot more intentional. We have so many people that are going through mental health challenges, and particularly, I'm always concerned about what our kids are experiencing, because we know that right now suicide rates for children, particularly for Black children, are higher than they've ever been, and higher than they are for any other racial demographic. So that's disconcerting to me. But anyway, so let's be mindful and of that, and being about that question and how are you, and really being open to hearing, that person may not be okay, and may need to talk, or may need to be excused from whatever gathering or meeting that's going on. Where are we? Oh, I know. I want to say, let the group know that we have, I want to lift up one of our community members. She's not with us right now tonight. Attorney Toya Howard is being recognized February 22nd. Um, Leading Light of Chicago Award recognition for some of her work she's an attorney, and so she does free legal aid services to seniors and to people with disabilities. And I just want to applaud and lift her up. It's amazing. We have such an amazing group of community members in our group who are showing up for our community in so many different ways. And so to me, that's just another way when you show up and you are of service to others, that's another way of showing that you are thriving and not just surviving during this pandemic. Also meant to also lift up Dr. Sandra Cato, because over the holidays, she did a whole Toys for Tots or Toys for Children program. And I'm sure they worked with like 22 families. They adopted 3 complete, families, and just like decked them out with all of the things that they would need for to have a really good Christmas. And then they had toys for for about 22 other families. So so again, I just love lifting up our members and talking about the things that they're doing, um, that says that they're thriving, not just surviving in this pandemic. And then I guess this might be old news. But I love that. Justin just got his blog up. London, is that you? It's on our website. London. Justin just came back from Paris. Not Paris. Came back from London over a week ago, and he met up with Patricia, and he wrote a blog about that experience and about how to travel safely, even in the midst of a pandemic, going out of the country. Again, other examples of thriving, not just simply surviving, really living it up during this pandemic. And I love that one picture of him where he has his mask and he has a glass of champagne and something and his air tamer on, and he's like, and he chilling. It's like nothing like seeing a Black man living life, okay, and living good. So
It's a really good blog.
and
If
it's
you
a
haven't
really
read
good.
it yet, it's really very good.
Hmm. Hmm. So on that note, let's go ahead and get started. Can I screen share? Okay, I guess I can. Zoom wants to share the content of the screen. Okay, so share. Okay, share. And let's see what what do I want to do? I want to go to here, and I want to go here. Okay. So, oh, this is our, so we know we are dealing with multiple variants, and they're coming. They're always, there's always going to be another variation coming down the pike, but this is where we're at. So as of 212, we're looking at the yellow is Omicron. So as you can see, it's pretty much gone. And what you have in the purple are the Omicron and the stealth version of Omicron that's now coming into or is the predominant variant that's in play right now. So the purple is the predominant one now, and one of those is uh, the stealth version of Omicron. So there are three, BA1, 2, and 3. It's highly contagious, as you know. Stealth variant is the one that is eluding detection from certain PCR tests, definitely the antigen tests, and so it is of some concern. Um, and it's eluding it just in terms of the current iterations of those tests, so they have to do more advanced testing to be able to pick up the other versions of Omicron. Last week we talked about COVID fatigue, and not long haul COVID. We talked about COVID fatigue in terms of we're tired of wearing a mask, we're weary of all the restrictions. Um, when is this stuff going to be over with? All of the, we had, and you can see that happening with, all over the United States. Now we know that the number of deaths are decreasing, and the number of I shouldn't say deaths, the number of hospitalizations are decreasing. So we presume that the number of deaths will also follow once the number of hospitalizations go down. Now, what we learned last week from the 1918, we learned last week, we looked at an article that talked about what happened in 1918. And so I'm just going to just review that a little bit. Most histories of the 1918 influenza pandemic that killed at least 50 million people worldwide most historians say that it ended in the summer of 1919 when a third wave of the respiratory contagion finally subsided. So we're kind of in that third wave. But yet in 1918, the virus continued to kill. A variant that emerged in 1920 was lethal enough that it should have counted as a fourth wave. In some cities, among them Detroit, Milwaukee, Minneapolis, and Kansas City, Missouri, deaths exceeded even those in the second wave, responsible for the vast majority of the pandemic deaths in the United States and elsewhere. So the fourth wave was the most deadly, and it killed the most people. Now this wave occurred, and this number of deaths occurred despite the fact that the United States population had plenty of natural immunity from the influenza virus after 2 years of infection and after viral lethality in the third wave had decreased. Now they didn't have vaccinations back then, but a lot of people had it, but it still came in like gangbusters and killed off a lot of folks in the fourth wave. Nearly all cities in the United States imposed strict restrictions during the pandemic's virulent second wave, which peaked in the fall of 1918. That winter, some cities reimposed controls when a third, though less deadly wave struck, but virtually no city responded in 1920. People were weary of influenza, and so were public officials. Okay. Newspapers were filled with frightening news about the virus, but no one cared. People at the same time ignored this fourth wave, so did historians. Deaths returned to pre-pandemic levels in 1921 of 1921, and the virus mutated. No, deaths returned to pre-pandemic levels in 1921, and the virus mutated into ordinary seasonal influenza, but the world had moved on well before. So we do not want to repeat that mistake. The virus is not done with us. Okay, it's not over. The virus is not done with us until we get to pre-pandemic uh, virus deaths. You know, we know that it's not over. Um, so what we do know at this point is that the pandemic has is not over. It's only just subsided, meaning that the number of deaths have reduced. The number, well, not yet, not yet. Should be coming though. We should hear those stats in the next week. The number of hospitalizations has subsided, which and then would not logically follow that the number of deaths would also decrease. Don't let your guard or your mask down, particularly in certain situations. So if you're older, you have comorbidities. I know a lot of states are talking about uh, re- lifting the mask mandate and certain other biosafety practices. They haven't done it yet in Chicago, but it's being contemplated. Uh, the reason why they're reducing some of these mandates is because they just want people to go back to doing what they've been doing and eating and drinking and going out and doing stuff and keeping the economy going. And and their concern is as long as we're not overrunning the hospitals, they can go ahead and lift some of these mandates. So it doesn't mean just because they're lifting the mandates does not mean that it's over or that there's no threat here. It just simply means that when people get sick, they're not going to overrun the hospital. That's the litmus test here. So don't let your guard or your mask down, particularly if you have, when I say in certain situations, you know, I think on some level you have to do a personal risk assessment. You know, what's your health status? Where are you going? What events? You know, what's the environment going to be like wherever you are? You know, so for example, even though hospitalizations are down in Chicago, we went out. My husband and I took when I went out to dinner last night. Well, I still took my air cave. I still had my ionizer with me. We had them on. We still followed the safety protocols. Um, and that's like for us, that is likely to continue. You know, I'm anemic, and my husband has, you know, three comorbidities. So just don't want to take any chances. That's unnecessary. So, you know, whether you should take you know, your mask down or whether it's uh, or not, it's not a simple yes or no answer, and it's not a simple on or off answer. And that's sometimes, you know, we like simplicity. We like for it to just be cut and dry, um, rather than nuanced or adding any kind of complexity to the answer. But we are not in a situation where things are cut and dry, or just a simple yes or no, mask on or off kind of situation. Um, you know, I'm probably going to have some issue with my child when it's time when if the mask mandates go off in terms of school, because they're talking about that in Chicago already, about whether kids are going to have be mandated to wear masks or not. You know, I might insist in my child, if he doesn't wear his mask, that he wears his ionizer all day, because I don't want him bringing anything back home to my husband who has four comorbidities. Period. The end in the story. Um, So, you know, that's where I'm at personally. So everybody is going to have to make some personal decisions and choices about what they are going to do and their family is going to do. So the question is, how can we know when the pandemic is over? We have, I'd like Michelle to pull up the video. So go ahead and take over the screen share. and pull up the video from Bloomberg, which talks about that. It's going to talk about what we can have, what possibly may happen over the next 6 months, and what we should be taking a look at.
The big uncertainty at this point is what happens next. We've all seen repeated waves of infection that have emerged as the virus mutates in order to evade the immunity that we've gotten thus far. That process is unlikely to stop. So the concern from scientists is that the next wave, the next mutation, might be something that's more dangerous than what we've seen already, and it could come back again and wallop everyone in the world one more time. That's the concern when it comes to allowing this virus to continue to spread. The thing that's important about booster shots is that it basically gives your immune system a little bit of a tweak. It gooses the immune system so that it is ready, so that it's alert, that it's aware that the virus could come back again. We see our neutralizing antibody production increase dramatically every time the immune system is exposed to the virus, whether that's through a natural infection or a vaccination. Now, of course, vaccination is the safest way to prime your immune system against the virus, because we know that's much less likely to make you sick, to land you in the hospital, than to actually get the infection itself. So the more times your immune system sees this virus, the more protected it can be, the more prepared it is to fight it off the way that it is now and the future variants. One of the most promising tools to fight the virus is the antiviral pills that are just now emerging from pharmaceutical companies. We know that the pills from Pfizer and Merck can help people recover from infection and can help reduce the risk of getting severely ill and dying. Now, this is important because it's not a vaccine. A pill isn't something that everyone needs to take. So it's not only a physical sense of protection, it's something that you can take if you've already been infected. It also gives people emotional protection. In the early days of the outbreak, if you got infected with coronavirus, there was very little that doctors could do for you unless you were severely ill, in which case they needed to put you on a ventilator. Now, doctors can give you a medicine that's going to dramatically slash your risk of dying from the infection, and it's only something that you need to take if you actually are sick. Not only that, it's something that's easy to take. It's a pill that you can get from your pharmacy and take it at home. Of course, there are still issues here. The pills aren't widely available to everyone, and manufacturing is increasing. But as the days and weeks continue and production ramps up, that's going to be an invaluable resource for people around the world to fight this virus. There are huge proportions of the world that haven't had any access at all to vaccinations. More than 25% of the world isn't vaccinated against coronavirus, and those are the places that are most at risk for developing the next variant. This is particularly true in places that are poor and places where many people have other immune conditions that make them vulnerable to getting this virus and throwing off the types of mutations that can cause severe disease in the future. Now, we've seen again and again that just having had an outbreak and just being vaccinated doesn't inoculate people against the virus itself. We saw it in London, we saw it in New York. The Delta wave came through, sickened millions of people, and then Omicron came back on top of that. The experts are clear in saying over and over again that until the world is vaccinated, until the entire world is protected against this virus, none of us are truly going to be safe.
Okay. I'm going to go back to my, okay, so there you have it. Until we have most of the world is vaccinated and or infected, but most of all vaccinated. And that's, we know that 25% of the world, and there are about 9 billion people on the planet. So we're talking 2 billion, 2.25 million people that have yet to have been, even close to being vaccinated, that haven't even been touched at all. And so there's plenty of room. Most of those are in poor countries. So if once the virus spreads in those poorer countries where there's inadequate health care, then the virus will find different ways and unusual ways to mutate and come back with a vengeance.
I'm sorry, can I ask you a question? That video, how can we, I'd like to view that video and look at it again. How can I get that video?
Michelle, can you send her the link? This is Patricia from London, right?
Renee.
Renee. Okay, sorry. You sounded like Patricia. You put your email in the chat box if you could, and we'll make sure that we send that out to you.
The link is in the chat.
Okay, I'm just seeing it now. Thank you.
Fabulous.
Then I have a question about that. About the pill. I thought I thought I heard someone said the pill wasn't a wise choice to take. And I'm not sure that was Dr. Rawlings who said. I don't know where I got that from, but someone was saying they didn't recommend the pill.
I think
can you explain it?
Yes, Paxlovid does interact with about 30 different common prescriptions that a lot of people take. I don't know. Right now, I don't know off the tip of my tongue the list of 30 different medications that it interacts with negatively. But some of those are like certain blood pressure medications, certain psychotropic medications, certain meaning depression medications, certain diabetic medications. So depression, diabetes, and high blood pressure are common ailments. And so if you have a cure or a treatment that interferes with or negatively has a negative interaction with those types of medication for those, for those conditions, then that's a serious issue. So one has to be careful about taking Paxlovid because of the interactions that it causes with certain kinds of medications. Right now, it's still in the testing phase. So they think it will work. It usually takes about another year or so before they'll have better background data on its safetyness and efficacy. So we're still a ways yet from having a cure, any kind of cure for COVID. So I think at least that's my understanding of what's been said and what Dr. Rowland was talking about.
Okay, thank you.
Yeah, it's a pretty strong medication. I think because you're only taking it for 4 or 5 days, 5 to 7 days, I'm sorry. There's less chance of some issues, but still, it could create problems for certain people who are also on other kinds of medication. Also, typically, because it's an antiviral and it's been used, or some component of that has been used with HIV treatment, there's also some liver. So you might not even be on any kind of medications, but there's also some issues around what does it do to one's liver. That's more of an issue if you're taking it long term. So think about it in terms of, okay, if you had COVID once this year, or there's certain people who've had COVID 3 or 4 times already in the course of 2 years. So for them to be on Paxlovid 3 or 4 times in the course of a year or two might be, that's a significant amount of drugs that, this particular drug being in one system. So there's also that to consider as well. Any other questions?
Most primary care physicians use an electronic medical record, and they have the ability to um, tell you there's functionality if it interferes with any other medication that you are taking. So it's nothing that you can do. You can't go to the pharmacy and just get the 4 pills. You have to have a prescription for it. So you'll be alerted if this medication would interact with any medication you're taking.
Okay, so this is something that someone that's had COVID before, they recommend.
Recording in progress.
I'm
I'm
sorry.
sorry, I didn't hear that. Can you repeat that?
This is something they recommend that to take if you had COVID before.
Not Paxlovid. That was what the lady was referring to in the video. She was talking about Paxlovid, which is an actual treatment for COVID, for when you actually have COVID.
Yeah.
It's a drug. Now, we've talked about supplements that you can take to help, to help prevent you from having COVID or having your body be well prepared to deal with COVID should you get it. We've talked about nitric oxide as a early, a supplement that one can take early on that can help in terms of preventing you from moving into having a serious encounter with COVID. But that's not the same thing. What this lady was talking about in the video was Paxlovid, which is a serious drug, a serious antiviral drug, first used in treating. It's in the family of drugs that they use to treat HIV.
Mm-hmm. And then you're not taking it after COVID. You have to take this
once you get diagnosed.
Yeah. Mm-hmm.
So, and they're still studying it.
Mm-hmm.
What can I say? Okay. So how do we know when, one of the ways in which we will know that this is over is monitoring our wastewater. I remember 2 years ago when I was talking to one of the commissioners for the Chicago Metropolitan Water District lives in my building. And I was bending her ear about monitoring the wastewater and, what are they doing? And, have you got anything in place to start not only monitoring the wastewater, but also making sure that the people who are working in the wastewater facilities have adequate PPE as they are monitoring the wastewater. And she just looked at me like I was crazy. And I, like, what is she talking about? And, um, I said, oh, you should talk to Dr. Rowland because he was definitely, on well, we will know when it's no longer in the water system, in the wastewater system, because it will show up in the fecal matter. Well, here we are, full on. That was 2 years ago. So here we are, fast forward 2 years. Now, people are, like, oh yeah, we got to monitor the wastewater. The CDC has now got a plan to monitor the wastewater across the nation. Now some of the data tracking is not complete, and this, the sister is still putting the system together and in place and getting it in place. So it's not usable data right now, but there is some places around the country are now monitoring the wastewater and looking at the presence or absence of COVID in the wastewater. So we have a neat little graph that shows you how it works. So we've got asymptomatic and symptomatic individuals, because when we're looking at symptomatic individuals, that's only going to tell you a piece of the story, because asymptomatic people can have COVID too, and you wouldn't know it but everybody, whether they're asymptomatic or symptomatic, they're shedding it in the feces. So, so that goes into the sewage system. They take wastewater samples at the treatment plant. They analyze it for the presence of SARS-CoV-2. And then the wastewater, they use the data from their collections to inform the public officials about what actions need to be taken. One of the ways, another way that they've used wastewater is on college campuses. They could tell when there was an outbreak within a particular dorm because they will measure the wastewater that came out of that particular dorm. Usually, the when it shows up in the fecal matter, that can be a precursor that will let you know that a surge is coming because you start shedding the virus long before you even have symptoms. So I'm not like months before, but like within a 2 to 3 days, you could be shedding virus, and then 2 to 3 days later start seeing the symptoms of that. So monitoring wastewater is an important step in understanding uh, potential surges in infection rates and monitoring the ups and downs. In some ways, it can be even better than testing because we don't always, if a person self-tests and they get a positive result, they're not necessarily reporting that to the CDC or whatever QR code that's, on their test kit. So we're not capturing through test data everybody who has been, uh, who may have.
Dr. Busman, excuse
Mhm.
me. How
Yes.
long did the CDC say it's going to take them to roll out this plan? And
Yeah.
how do they plan to meet rural areas the need for this? Because I mean, we can't even get PPE across the country, and you talking about something scientific test. It's like it's going to take the government too long to roll this out. How long did they project? How long it'll take them?
To be honest with you, I didn't see anywhere on their site where it said how long it was going to take for them to roll. Number one. Number two, I don't think that they're going to do the entire. It's not like every wastewater treatment center
Right.
in place is going to have a sample for a sampling facility. I think that they're going to do it. It looks like they're going to do it in regions, maybe in the large centers or the large wastewater plants, and then look at the center. So they're going to um, extrapolate from the data what
Yeah.
that region's
And sometimes with
infection rates might be.
extrapolations, that's not going to always give them accurate information, because you have to remember the Black and brown people like ourselves, we're the ones that are going to be more susceptible. So if they are not necessarily extrapolating data from those areas, then there is definitely going to be, you know, some issues with their data. So I was just curious. I mean, I don't mean to be negative, but unfortunately, that's how our government is. We come up with these plans, but it's
Mhm.
like, okay, how are you gonna initiate this plan so that you are extrapolating a high enough percentage to get an accurate view of what's actually going on?
Well, you're not being negative, you're being factual and pragmatic. And it's a good thing to be able to talk about where are the holes in the data. Okay. Because you
Well, I'm a
actually,
data analyst, so
there you go.
that's why I'm saying this and I'm asking this. And it's like,
Right.
I just don't want us to get a false sense of security. And
Correct.
that's why I like these conversations that we have. And, that basically the bottom line is like you and Miss Miller. And I guess even when Dr. Rowland is on here, you still have to do your biosafety protocol.
Absolutely. Absolutely. So, so speaking to that, the data may not be accurate. It's important to remember that there's a whole subset of people who are not on like the city or the county sewer systems. They may have,
Exactly.
they may be on private septic tanks or septic systems, and some people are on don't even have a septic system. Their effluent is just running out into empty fields somewhere. So think about people that you know who live in certain southern or rural, southern states or rural areas where their septic systems are not even tied into a tank or into the city waste or the county wastewater treatment facilities. And that is a huge part of, they're more likely to be Black and brown communities. And that's going to be a huge hole in the data right there, because it may be circulating in certain populations, but we won't be able to measure it in those areas of the city, or rural communities where there's lots of people on septic systems, or not on any kind of septic system at all.
Right. And
So think
yeah,
about people who are living in like mobile homes.
right. And use septic tanks in the rural areas.
Hmm. Correct. Correct.
Yeah. And the only way that you can
We had
actually, you gotta, the thing about empowerment in a situation where you are extrapolating information at this level is your civic involvement. So this would require you picking up the phone and calling your leaders in those areas, finding out if they are treating or testing, um, to get that information. And so the data is used in various ways. The graphs that Dr. Blessman used to show where the prevalence of the virus is and which mutation we're dealing with. Most of that is coming from wastewater treatment for the prevalence, and then the spread is coming from your genome sequence when they do it.
Mhm.
Right. So it's all there's always going to be the disparage in healthcare, because the value system on skin color changes. We know that. And so, um, but the understanding of how we are getting some of this information, where it's coming from, it's not disinformation, it's not misinformation. This information is out here. The reason doctor is sharing it is more or less to educate you as to how this pandemic is being uh, traced.
Trace. Hmm. Yeah. And but in some places it is going to kind of make sense. Like in Chicago, most of Chicago, Chicago is, if you live in the city of Chicago, I don't think that there's very many places or even in the surrounding counties and suburbs where you would not be on some kind of wastewater treatment system. But if you go to downstate Illinois, and there are certainly a lot of rural counties outside of Peoria where a lot of Black folks live, or around East St. Louis where a lot of Black folks live, Moline, um, and I know some of these names may not make sense to a lot of you on this call, but if you can think about think about your state or your area where people are likely to not be on on a city sewer system, but may actually be on a septic system or not on any system at all. And if those are Black and brown people, those communities we won't have adequate data about how the prevalence of corona in those communities, because we're not able to actually manage or monitor what's happening with their septic systems or their wastewater. So yeah, but ideally this is how it works. And but if they're using wastewater data, if the wastewater data is being used to inform public health actions, then we also need to supplement some of that data with real live testing, because they know where the areas are where folks are either on septic tanks or on no system at all. So they can supplement that data by doing other kinds of testing to determine the prevalence of COVID in those communities. So it's a question of, as Ms. Miller said, getting active with politicians or the commissioners and think through, okay, well, how do we collect that data for those people who are not on the wastewater system? So again, um, there's headlines out there saying latest on COVID in Minnesota, wastewater data, falling case count signals the pandemic's ebb. Okay, they're not saying it's over, they're just saying the surge is subsiding. What does Utah's sewage system say now about how prevalent COVID is in our community? So we know that, oh, here's the scoop on the poop, virus is trending down in some major areas. Okay, so maybe it's trending down in some areas where we have access to wastewater treatment systems, but we don't know. I know Minnesota has a number of communities that are in rural areas where a number of folks are on septic systems and a number of folks are on or no systems at all. We know also even in Utah, because I don't like to always talk about the southern states. There's, same stuff happens in the northern states too. There are people who are not on city or county wastewater treatment systems. They may be on septic systems, or they may not be. They may be on no kind of system at all. It's just the runoff is just going into the ground somewhere. They have a pipe and it's running 40 or 50 feet away from their house and just emptying into some kind of ditch or whatever setup the homeowner has made for moving wastewater away from their living facilities. So, the other piece uh, that we also want to take a look at, or somebody mentioned last week that, oh yeah, they found in the New York City sewage a mysterious coronavirus signal. So yeah, they're also using wastewater to detect um, uh, new variants that may be coming up. But that's happening not only in New York, it's also happening in California. So this could be an important way to determine if there's some new variant that's popping up um, that may become prevalent in the population. So measuring the amount of SARS-CoV-2 in wastewater can provide information on trends in the number of people with COVID in the community contributing to that wastewater. Therefore, wastewater surveillance can be an additional indicator of change in the amount of COVID-19 in a community. However, because the sewer system also captures waters from non-household sources like rainwater and industrial sources, and because not everyone shares the same amount of virus, wastewater surveillance cannot tell the exact number of people with COVID, and it is best interpreted as a trend over time and used as a complement to other surveillance data that informs public health decision making. Case counts from clinical testing and hospital admissions. Specialized testing of wastewater, like genomic sequencing, can detect variants of SARS-CoV-2, for example, variants of concern like Delta and Omicron or the stealth of Omicron, stuff like that. If our poop could talk, it would tell us that the worst of the Omicron variant has likely passed. Um, why does this matter? Wastewater surveillance can monitor disease outbreaks without relying on testing. So it can be something that can be used in addition to testing. It can also serve as an early warning for macro trends, as people often shed the virus before they are symptomatic. Um, it could provide an early warning signal of an upcoming surge or an early warning of a new variant that is about to emerge in the population. So it's not a perfect indicator, but it is a useful term. Wastewater surveillance is a useful term. Uh, useful tool that we can use to monitor and track what's happening with COVID. Not perfect though, we got that. Okay, so here are the key takeaways from tonight. It's not over, folks. This pandemic is not over. There's still more to come. It's still mutating. The virus is not done with us. The virus is still mutating, will continue to spread and mutate until most of the world has either been infected or vaccinated. And we know that a quarter of the world has not been is has not been infected and or vaccinated. Keep your guard up along with your mask. Um, and then we have some signals about when it might be over. For example, when it's no longer in our waste system, but that's not a perfect tool, but it does say something when it's not in the wastewater. Um, most of the world, we'll know it's over when most of the world has been infected or vaccinated. We're a long way from that. Um, and we know it's over when there's a cure. And there's a difference between a treatment and a cure. Treatment is something that relieves symptoms. A cure is when you can take something and it actually gets rid of, kills, deactivates the virus in your body. That is a cure. Right now, we only have symptom relief measures that we can take. Okay, I'm going to let this uh, sit for a minute. The seven F's and an R, because we have, so every once in a while it's good to just kind of keep that or review that again. Um, we need to be cognizant of how a virus is spread, um, making sure that we stay up on our biosafety protocols, learning situational awareness. Situational awareness, as we learned from Dr. Rowland, situational awareness is not just common touch items, common touch places, and in the places that we go, like door handles and uh, toilet handles and faucet handles and things of that nature. It's also being aware of situations that might cause you to let your guard down about using your biosafety protocols. So I'll give you an example. Um, my husband's father passed away, and it was a while ago. So we are now planning his memorial service. And I know that I've been to other memorial services, and I can tell you the last thing that people have even thought about is the COVID safety protocols. Or, and the closest that I've even gotten to anybody even thinking about uh, the COVID safety protocols was that they chose a church where they knew that the church itself provided hand sanitation on the way in, and they had markings on the pews to indicate where family groups could sit so that people could be spaced out. But that's it. I mean, that's, but it was like there was nothing that was really said or done, or that in the planning of it that people really took a look at, okay, who's coming, how do we plan for uh, what's likely to happen during the course of a funeral service and repast, and thinking through the COVID safety protocols. And I get it, because people are upset that, their loved one has passed away. They're upset. It's kind of so like the last thing you really think about doing. But in this day and age, and because of this pandemic, it needs to come in as part of not necessarily front and center, but it needs to come in as part of the planning, because people will be forgetful. They haven't seen Aunt Mabel in 2 years. And so what's the natural thing to do? Go up to Aunt Mabel and give Aunt Mabel a big kiss and a hug, okay? And it's not that you can't do those things. What we've decided to do is, we're going to make sure that we're going to let everybody know that we would prefer everybody to have ionizers, because we know that there's going to be kiss and hugging getting in each other's face, but we definitely going to provide it for anybody that's over 65. We're going to buy ionizers for them so that they have, something that will be protective of them. Our elder, and my husband's father was like 92 when he passed away. So everybody that he knows, all of his friends are going to be older people. And so we don't want this to be a super spreader event for them, just to come to say goodbye to Alan. We don't want anybody else to get harmed or hurt in the course of hosting this memorial service. So we need to think about situational awareness, in other kinds of, in other ways. Dr. Rowland talked about how, when he's in a room with people that he thinks are important or famous, that he lets his guard down, and he said he had been to a couple of things like that, to a couple of events like that, and he knows that that's where, and it was in those situations that he let his guard down and did have his mask on and probably got some, you know. Um, and I can understand that, that I can understand being in a situation like that and that happening. So, and that's a point where it's important to know who you are, know yourself, think about what might be the occasions that might um, get you to put your guard down. Was a couple of weeks ago when we had Miss Antoinette on, she talked about how her children, her grandchildren, ended up coming into her home. Kind of, it was a kind of an emergency, and they ended up coming into her home to stay with her. And the kids were already sick, and but in the middle of the night, one of the babies, was coughing and crying, and she went in there. She forgot her mask, and she said that's probably the moment when she caught COVID, you know, because she was half asleep and she wasn't thinking. Um, so, so don't let your guard down. Keep it, and don't let your mask down, and practice some self-awareness, in regards to your own situational awareness. Okay, we can go back. Let me stop this share. Okay.
So what I've noticed, and come to learn with some experiences that have been in my close circles is if you know that that you are immune compromised, your biosafety protocol skills should be on point. Just they have to be like flawless, because more than likely you're not building any antibodies. You're not really able to protect yourself because you're dealing with another illness, and this virus invades, and it can take over quickly because the science is showing us that the vaccines are working, that they do have some efficacy, even though we do have some breakthrough cases. People are saying, well, I was vaccinated and got COVID. There's just some things that we know. We don't have enough antibodies with the first and second shots. You have to get a booster. The booster will help you with your efficacy, and we might have to get a number 4, depending on what is coming our way in the next couple of weeks, not months, weeks. If you are immune compromised, autoimmune compromised, you got some deficiencies and you know it. No one is saying that you need to give us your whole health background, but you know that you have some stuff going on. Make sure that you have your Living Guard mask. I love that Living Guard mask. I do. It's time for me to buy another one. But I truly love that Living Guard mask for traveling. It's light. I can adjust the straps behind my ears, and I can adjust the nose bridge because I wear glasses to stop the fogging. I really, really like the Living Guard mask. So if you have purchased a Living Guard mask 30 days ago, you need to be buying another Living Guard mask.
No, no, you don't.
So was it
That one
21? Well, I use mine as well. Yeah, I fly. So yeah, if you're using it every
20
day,
washings, 20 washings.
20
So some,
washings, right?
yeah,
Yeah.
it depends on how much usage you get.
Yeah, how much you're using it. Yeah, that's true. But if you're using it, well, I'm thinking about I'm thinking about there's more movement now than it was last year. We were still really a lot more quarantined last year than we are this year because we have access to more entertainment and more things to do. Restaurants are opening. So I'm thinking about the usage is, if you're finding that you are being more active, then, you might be washing your Living Guard mask or, when I say wash your Living Guard mask, just with some tap water, no
No detergents.
no
Yeah,
detergents. Just some, some water, tap water, wring it out and hang it up and let it dry and you're good. So 21 of those kinds of washes, not in the laundry with your panties.
No.
So I really, really like the Living Guard mask. I absolutely love my ionizer. I do wear it when I travel on the plane, at church, when I know I'm going to be in an area where I need to take my mask down. I definitely have my ionizer. And my ionizer lasted me Friday at about 1 o'clock. I put it around my neck and I traveled all day. I didn't get back to Montgomery until 11 o'clock at night on Friday night, and my ionizer was still blinking green. I love my ionizer. It has a lasting charge.
Michelle, which ionizer did you purchase? Can you put that one in the link?
I think I can, because Dr. Blessman and I were like looking at ionizers, and she was like, "You got get you one. Just find you one." And she sent me like,
I saw some on Amazon, and I was about to purchase them, but I've been doing like research on them before I do. So that's why I just wanted to see if y'all had a suggestion.
I can find the one that, because I bought mine on Amazon too.
Okay.
So and I think when I mean, yeah, just I can't even talk today. Ionizers are based on your pocketbook and your aesthetic. Because I think at one point when we were looking at ionizers for Michelle, you were getting ready to go to a wedding, so we kind of wanted one that was a little bit cute. So to kind of to go with your outfit and the bling bling of your outfit. So we're like, okay, let's do this one. So basically, it's like the more expensive they are, the longer they'll probably last on a single charge. So you can do an air timer, which is like, it's pretty pricey. It's $149, but it lasts for about 150 hours, which is basically about a week. Yes, this Lufttrim is it's kind of, it's a little bit different. You could probably bling it out a little bit if you wanted to glue sparkles on it or something. And it's $22, and it lasts for what? 20, 30 hours,
yeah, it's
something like that.
Nice. It was still going.
Yeah. So, so if it'll last through any, if you're if you're traveling domestic flight, even if you were traveling from, say, the East Coast to Hawaii, that should last you the entire time. It can be used for 24 hours after charging for 30 minutes. So, that's pretty good. That would pretty much last you even through an international flight.
I'm telling you, that thing was like,
hours. Yeah.
It was doing it.
Oh, I know that. Okay, I'm glad we reviewed that one again. Yeah,
Thank you.
Yeah, and there's other kinds, like some that are not like a necklace but look like headphones, I think they last 15 or 20 hours on a single charge, and then like $20, $23, something like that. So they're different kinds. Some are all black, some are white, some are, it's all about your, at that point, aesthetic and what you need it for. I wanted one that, because I did do international travel, and I didn't want to be somewhere like in some foreign countries, the outlets are not the same. So I didn't want to have to worry about charging my air purifier mid travel. So I got one that I knew was going to last me for a very long time without having to worry about that going out. My phone can go out, my iPad can go out, but my ionizer cannot. I cannot, and that needs to continue until I get home. Okay, or get someplace where I can really pull out my charging stuff and my international charging blocks and set up somewhere. But um, so lifestyle, aesthetic, and your pocketbook should be the choices on that. Yeah, I don't have a particular one that I like more than another, or anything like that. Okay.
Yeah, I didn't even know about them, and I didn't know that they worked so well, right? Because I was in a situation where some folks got COVID around me, and I was I was pretty much the only one that I didn't have
Right.
COVID.
Right. I was going later. I'm going to, well, yeah, because you may not want to talk about this on a recorded venue, but um, I will ask about that. Um, how they're doing, the folks that you were
Oh,
around.
yeah, everybody's fine.
Everybody's fine. Oh,
Yes.
that's good. That's good. I hope the organization is not going to do something different in terms of their biosafety.
They're actually ramping it up a little bit, doing better.
Okay then. Okay then. So they learned.
Yes.
Sometimes, as my grandmother has a story about how people learn. My grandmother was like one of the best psychologists. My grandmother had like a grammar school education, but she was one of the best psychologists that I ever met. And people came to her in the community. She was a community healer, and people would come to her and tell them their situations, and she'd listen, and she'd give them sage advice. And they paid her in chickens and greens, or bushels of string beans, or stuff out their garden, whatever. Okay. But my grandmother would say, she would say that there's three kinds of learners. She said there's the learner who, you can tell them the stove is hot, and they'll hear it and they'll say, oh, okay, she said the stove is hot, so I'm going to best believe the stove is hot, and I'm going to leave the stove alone. And she said then there's a second kind of learner who, they will hear that the stove is hot, and they'll start walking towards the stove. Stove is getting a little warmer, and they'll say, oh, stove is getting warmer. Best believe that the stove is hot. Let me not get any closer to the stove. And then there's a third type of learner who actually has to, even though they're walking towards us, they heard what you said, they start walking towards the stove and they can feel it getting warm, but they actually have to touch the stove before they believe that the stove is indeed hot, okay, and burn themselves before they get it. So sometimes there are people who have to learn from direct experience, and unfortunately may have to learn from stinging experience, get burnt before they're willing to say, oops, got to make a change. So you got to meet people where they are.
Yeah.
And if
Most
this is what
definitely.
it took for them to move in a different direction, then capitalize on that. And you just
Yes.
have to move forward, you know. Yeah, thank God they're not. Now I told my grandmother after I got my PhD, I said, Grandma, there's a fourth kind of person. And thank God, I really don't want to deal with these kind of people. those are the ones that have to touch the stove 4 or 5 times before they learn the
Before they
lesson.
then get blisters, fingers wrapped up, teeth. Second, third degree burns, they still touch the stove. That's
They're gonna
crazy.
touch it again, touch the stove again, 1 time, 2 times, 3 times, 4 times. Because they tell themselves all kinds of stuff. Oh, it wasn't really hot. It wasn't really that hot. Maybe it's not hot no anymore. Yeah, okay.
Right. No, it's still hot. It ain't even cooled down yet. But the
Okay.
victory story, right? So I I have a lot of like sad woo-woo stories. Like things could have been different if only. But the rah-rah story that keeps me pressing on with my biosafety protocols is watching my 74-year-old mother go to work every day in a school and has not had COVID. Like I have been applauding her the last couple of weeks. I'm like, you know, you're better at your biosafety protocols than I am. But he keeps, she's like, Michelle, I have that alcohol and I spray those desks. I spray the pens. I keep my mask on. I put my skin guard on during the day, but when I go, to the restroom, I wash my hands. I still know the skin guard is on there, but I'm washing my hands. I'm using hand sanitizer, and she's around the pupils, other teachers. Now the parents are coming in with you get an opportunity to review the school, the open house. So they're coming in and out, and she has just been doing very well. So I know for a fact that, and it's not like COVID is not in her school. They have 2 or 3 students leaving every day, being called to the nurse's office because they have a positive COVID read. So it's not like she's, not in an environment where COVID is not. No, COVID is rampant in her school. They wear masks in school, but it's, when a kid go home, they bring it back. So just because she does those simple things, my mom has not had COVID. And so, I can definitely, and she doesn't have an ionizer. I haven't bought her one yet because she really doesn't do anything extra on the weekends. But when she does, she's masked up and has her skin guard, and she carries a bottle of Clean Smart with her when she's not in school. She has her alcohol while she's in school, and she has some Clean Smart, but for the most part, she uses the alcohol because she's spraying constantly. But she has not had COVID, and so that's my rah rah story. And she's vaccinated and boosted, so yeah,
Okay.
it can be
Does she
done.
does she eat lunch at school?
She brings her food with her. She eats at her
Okay.
desk, um,
Okay.
and she has the media and the library. So there are times, during the week where the students have to come into her space. And
Okay.
so yeah, so I'm just like, she biosafety protocol. She
Get get
yeah,
her get her an ionizer
I know.
so
I
she can go out
will.
to dinner. Yeah, so she can go out to dinner. She can that'll expand her options of things that she can do. I
Mm-hmm.
tell you, there's a couple that there's a couple that I visit on Sundays, and they're like 94, 92, and Dr. Betty and Dr. Peyton. And so Dr. Betty loves to go out, and so I have taken her out, and I got her an ionizer so that we could go out. And she loves to go out and eat. So it's like, okay, well, so I'm very careful about where we're going and all that. But I got her an ionizer just so that we could have an adventure, go and have something to eat outside, leave the house. Um, because she's kind of homebound. She's in a walker and she's homebound right now. So getting out and just going someplace and getting like we went to the Museum of Science and Industry and had not the Field Museum, and had a bite to eat while we were there, and that just helped so much to have for her to have an ionizer because she's on a walker. she's not always able to pull up her mask and keep it over her nose because her hands are on a walker, you know. So the ionizer was another level of protection for her when when and if her mask slipped down below her nose and that kind of thing. But
Yes.
yeah, that would, she could go out to eat with you. I mean, you all could go out to eat and do stuff like that if she had an ionizer. And it'd be safer for her. Well, she's in the media room, so she's not like trying to do the lunchroom with the kids and eat
Right
with them.
now. And I don't think Dr. Starts is pretty good about her biosafety protocols in this temporary school that they're in, because her school is actually being built.
Mm,
I don't think they actually sit together like that for lunchtime. I'll have to ask my mom, but I don't think there's no real cafeteria action at her school.
got you. Got you.
Yeah, so the product works. It really does.
Okay. Okay. Any other? Re- Oh, Renee you're on I see you have yours. I love that one too. That's pretty. Renee, you're muted,
I
so we
like that
can't
Oh
hear
too.
you.
yeah, I just wanted to share. I got one of these. One of these, and I got it from Amazon, but I think it was like maybe $12.99. It has it's charged for 48 hours, but it takes 2 hours to charge.
Okay. But it lasts for
That's a
48 hours.
48 hours, yeah. And so
Oh,
I
that's
wore it
pretty
the
good.
other day. Yeah.
Yes.
I bought one for my mom and my daughter, and they have these little ones for the children. So I bought one for my granddaughter and my niece.
And that was
So
12.99.
yeah, this one was $12.99.
Yeah, I need to find that one because we got to buy a whole bunch of them. So I need to find that one.
But
Can you?
hold on, that was on Amazon. Let me see. Uh,
Because
I
I
got
haven't
that on.
seen them as low as 12.99 yet. So I think I got to like 19, but not 12. And
Yeah, it
that's a
was $12.99. So I bought about maybe four of them.
Mhm.
Are those for children too?
Well, no, they had a different one for the children. They was like I think $11.99.
Oh, okay. Thanks.
This one had I guess this must be the number. It's like they got Winix, WINIX 5500.
Wait a minute,
Yes.
wait a minute. Writing it down. WinX, WINIX. And what was the number?
Oops, wait a minute. 5500. It has a true HEPA in it, they said.
True helper.
What is this? Plasma wave.
Huh.
You got it, man.
Oh, it's a
That's the number
5.
that's right above it. Yeah, I can't see that. Nope.
Kids is $11.
Got me looking for it.
Really?
I don't know why that says 154. That can't be.
No, it's not showing that.
Well, you know what? Because that's right above it, so that's weird. And I'm learning how to do this Amazon. I had somebody order it for me, but it's right above it. So you know what? Maybe that's not it. It's really weird how they have it.
Hmm. Did you order it or did somebody order it for you?
I had somebody order it for me
Oh, okay. Okay.
because I didn't have Amazon Prime.
Because I was gonna say, oh, just send it, because usually they have under the buy again, or you can go back to your account and, there's a little icon that says
Yeah, so
share.
now I have no account, so I said I need y'all to order this for me. But it says Amazon it says Amazon air purifier in-home purifier ear necklace portable. That's all it's saying when you hit the link.
Yeah, the Winx, when I hit it, it's showing the room air purifier, the room size ones, not the.
So
Not your little-
try visit the OV, because it says OVICISK store.
OVICISK store.
Store.
Okay. We'll try.
Oh,
Okay.
say that one more
That's-
time. Say that one more time. OV.
It's an OVICISK store.
SK
Let me
store.
scroll down and see what else it says.
OVISK.
OVICISK.
No, I'm still not getting it.
And that's what it says. It says visit the store on here. So that's what it's sold by.
Hmm.
Hmm.
Oh, Renee, you got lucky.
Yeah, you did. You found a really good deal. 48 hours and at $12.99. That was nice. That was nice.
Do you want me to text this to you? Because then I can text you then maybe you can, maybe I'm not seeing something. You want me to text it to somebody?
Can you put it in
You
the
put it in the
chat?
chat.
Hmm?
You can put
See, I
it
don't know how to put it in the chat. It's on my phone.
Okay. Hold on.
Don't worry about it. We'll figure it out.
Yeah, I'll get it.
We'll figure
Send me
it
a
out.
message and I'll text it to you. Put me a message. You can do it in the chat.
Put my phone in the chat.
Yeah, and I'll text it to you. You'll see, Bob. I'll text you the Dell indicators. And maybe you might be able to pull it up real quick. Okay, hold on a second.
Spencer, write this number down. 334 490 334
I'm going to send it right now. 334 490 3030.
3030. And write the other one down. 773 490 060.
No.
Could you repeat the number one more time, please?
773 490. Everybody got that one. I gave you two numbers.
Okay, I just sent it. Did you get it?
You said you texted it to me?
I texted, yep.
Not yet. We'll figure it out. I got a little bit of time, so if I don't get it, I will contact you again. So it's 8:23, folks. Is there anything else any other burning questions that we want to get answered?
Oh, how is the information about the Novavax shots?
That's a good question. All I know at this point is that they've applied for their
they did.
emergency use authorization.
And we're waiting.
We're waiting.
The data has come back that it has a better efficacy than Pfizer and Moderna.
So that'd be sometime in March, you think, Michelle?
Hopefully. I mean, it depends on how long it'll take our government to allow us, because they apply for emergency use. So, I mean, I still have maybe a couple of more months before I take it as a booster, but I'm sure hopefully it'll be available by then.
So yeah, because no one's really had a shot, first or second shot of that one anyway.
Right. But they're saying that the clinical trials came back saying that it has a longer lifespan, and then that it is effective against the Omicron and the Delta. So
Oh,
they're believing that it, it will be a good force against whatever other mutations come out of it. And it's not an mRNA, though
okay.
they try to replicate some of the spike proteins. It is not an mRNA.
Mm-hmm.
Yeah, this is,
Great.
it looks good. It looks like a
It's
way
really
better
good.
vaccine than Pfizer. And no, and their reaction level to the protein serum is real low too. So
Oh,
I'm gonna find that. I'm gonna see if I can try to find the article before we close.
Yeah, what I know, I have a friend who is not vaccinated because her body is so sensitive. There's a whole lot of over-the-counter medications that she can't
we have
take.
a charge up here.
Her body just does not react well to anything, and I mean, a mosquito bite sent her to the hospital. I mean, that's how, that's how particular her system is. So she does not like to put drugs, no, any kind of, not, certainly not any recreational stuff. She doesn't drink. She doesn't, she doesn't do any, there's a whole lot of stuff she does not do. Caffeine, none of that. So she was waiting, and her biosafety is on point. It is on point. Um, but she was waiting for a much safer vaccine to come out. And so we think the Novavax is, I've been following some of the articles about the safety measures, the safety data. And so far, we know that people have fewer reactions, negative reactions to getting the Novavax shot. And as far as they can tell, um, the safety profile looks really, 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 really good for Novavax, much better. So we're just waiting for it to get the approval as an emergency use authorization. And then, so that's the step one. And then step two would be, um, they're ramping up production, but we have no idea when it's going to be readily available to the public. You know, and I know Dr. Rowland was kind of waiting for more, the safer vaccine to come out before he got vaccinated. It's just that he got COVID before it came out. So
I just put a Wall Street Journal article in the chat. This is saying that this will be a good booster option. Yes. And then here's one that came out last night that I think will be a good read. So for all of our Novavax anticipation.
yay! It came through. Thank you. Thank you, Renee. Um, the link for the ionizer came through.
Oh, good.
Mhm.
I think Belinda also put it on the chat too.
Dr. Blessman.
Yes. Mhm.
I was like Dr. Rowland. I'm trying to wait till the Novavax come out also. So, hurry.
You're almost there. Just hold
Yeah.
on. Keep your
Yeah.
safety protocols on point.
Yeah.
Just keep them on point. You're almost there. I mean, I can't imagine that. I would think within the next 60 days, it should be out. I can't imagine it would take longer than that. But
Yes, I hope
you know,
not.
you
Yeah.
know,
Well,
So-
next 30 days won't be, be very nice too.
well, 30 days would be nice, but I can't imagine it past
Yeah.
60.
Yeah. I got you. I got
You
you.
know, you come this far.
I know. I
You
know.
know.
The last link that I put in the chat, I wanted to just bring this to y'all's attention. I don't know if you watched the Super Bowl on Sunday. I'm a big fan of the commercials. And so this Q Health will detect COVID. It's like an Alexa. So there's a link, check it out.
What does it do? What'd you say?
Detects COVID and if you have COVID.
It's like Michelle, that's what I mentioned last week about trying to get a link for that, because this young man said, oh, somebody's got COVID, we gotta go.
I thought you were talking about a text, like a
Well,
text.
that comes up too if you have the application.
Yeah.
But this is a device.
Or a device.
Mm-hmm.
Oh, it's not like on your. It's not like you can get it.
California do show that retail theft went up in 2021, but back to pre-pandemic levels, which is still below historic highs.
No, somebody's TV is on, please.
Yeah. So this device can detect.
QHealth.com.
Yes, I put the link in the chat because that was the name of the device and company. And just take a look at it when you get a chance. The technology is definitely changing.
Mm-hmm. So Michelle, when I was telling you last week about you have it on your phone, your app on your phone.
Mm-hmm.
This is altogether different, huh? I see.
This is detecting if your child comes in the house, it'll say that this child has COVID.
Wait a minute, how can it?
I don't know. That was the commercial.
Okay, so the only thing that I know of, I mean, if you've tested, for example, I've gone to a testing facility, a testing site, and when I went to that facility and got my COVID test, I got, they give me my results back, but they also give you a QR code. So I'm pretty sure that QR code is being stored somewhere. And somebody has monitored me at least 4 times because I've had that.
No, this is a lab test, doctor. This is testing in your home.
So Michelle, is it like a PCR test, or is it more like the concept in physics where we're like testing for radiation?
Let me show you.
Okay, Michelle, let's not give people information. Let's take a look at it.
Yeah, because I'm gonna look at it too. That's why I was like, okay.
Yeah, it's the link. That's why I put the link in the chat so you can look at it.
Okay. And we can have that discussion
next week.
Next week. How about that?
Sounds good.
Health.com. Okay. So, so I guess we're gonna talk about testing next week and all the ways in which people can be monitoring. The week after that, I think the first week of March. I know I'm going too fast. Justin has somebody that's going to come on to talk about. Justin, are you there?
Yeah. So I have a friend who is in the healthcare profession out here in Southern California, and she's actually working with USC, and she's faced with COVID on a very huge public scale because she's in med school. So she's actually been starting her residency and fellowship and her whole track through med school when COVID really hit. So she has a perspective that a lot of us don't have because she sees it every single day for like 14 to 15 hours a day for the past like consecutive weeks on end. So she sees trends and she sees, you know, what's really going on in the hospital beds and in the records and how they're being handled compared to a lot of the other like private institutions in the hospital industry out here or in general. So she'll be on to kind of let us know like we're still hashing out like what she's really going to talk about, so we don't like confuse anyone or throw out information that's irrelevant to our community. But she is within the industry and a viable source, so that's exciting.
Oh yeah, I'm excited.
Mhm.
Oh yeah, absolutely. Because I think we've been when people say, well, have asked, well, what's the point of, if we are going to catch it? What's the point of doing all this biosafety? It's because you don't want to be in the hospital. You don't want to have to face what the hospital. If you don't see what's happening in hospitals and understand what's going on, how they're overwhelmed and overrun, and just and just the sheer magnitude of uh, work that needs to be done, and the fact that a number of, like they're saying, like a quarter of the nursing population has left the field. And
Right.
so, um,
Yeah.
right, you need to do your biosafety security protocols because you don't want to go to the hospital. You don't want to be in a situation where you have to be at the hospital, because the kind of care that you need in order to be in you need more intensive nursing care with COVID in order to get through COVID. And this is just not the time to get sick. Not go and get COVID. Mm-mm, mm-mm. God forbid. I just heard a story about a person who got COVID, was intubated, and they took him off after 2 weeks. So if you're and their organs weren't deteriorating or anything like that, but it's like, I mean, they don't care. It's like they have these, they're rationing care now. They're talking, so if you don't, and it may take some people 3 weeks or 4 weeks or 5 weeks. The person is not going to recover when their organs actually start to fail. This was not this person's situation, and they took them off anyway. So you just don't want to be in this situation right now. So that's another reason for keeping your guard up and your mask up too, because even though the infection rates are maybe going down, hospitalization rates may be going down. It may not be down enough in your community, in your hospital, where you might end up if you were to get sick. And so, hold up, don't change up too fast now. You got time. You made it this far with masking up and doing all your biosafety security protocols. You can wait a little while longer. Okay.
That's exactly what her name is Sarah, Dr. Sarah Garvey. She's been saying things like that too, and she's just getting beaten down with like, the Super Bowl, and then seeing that Coachella just said that you can get into Coachella without a vaccination card, without a negative COVID test, without a mask, without anything, as if it was like 2012. And she's like, I'm dealing with people who are dying from this from the sun up to the sun down, and we have the public acting as if it is just a regular weekend all over again. So she has the anger and passion that like we use too as we try and fight all of this, but sanctions are being lifted and restrictions are being set back.
Wow.
Yeah, Coachella just, I think, announced that about 2 hours ago that all attendees, I'll actually read the headline real quick. They said that Coachella drops all COVID-19 precautions. Attendees won't be required to show vaccination proof, negative test result, or wear masks.
Show me the money, damn it, darn it. Yeah. We are this pandemic policy is strictly economic based only. It has nothing to do with race, class. It's economics. Because
Right.
COVID don't care if you're white, black, yellow, green, polka dot, striped.
But we're going to see, Michelle and Dr. Blessman, unfortunately, when we take these mask mandates down, and that's what we're dealing with here in the DMV area, we're gonna see spikes. And it's like they're like everything is trending down, and it's not getting better because they're not showing us the numbers of the people dying every day and the transmission rate. So we still have to practice our biosafety protocol. I can't stress that enough.
Mm-hmm. Pretend like everybody got COVID.
This is serious. I mean, like you said, Michelle, because people are profiting, they don't care about people's health. They don't care about the healthcare workers.
Only the strong survive in this venue. So being strong means eating properly and eating healthy. And we're not going to veer off of that topic, though we venture into the elements of what this pandemic is looking like, how it's impacting us. Where are the public safety policies? We can point to wastewater as being one, but it doesn't mean that that is going to create any kind of policy around how we take care of each other. So we take care of each other by coming every Tuesday, getting this information, taking it and sharing it with those who don't know and don't understand. We're still dying. We're still getting sick. And we got to make sure that we are protecting ourselves and our loved ones too. So this has been a great conversation. I thank you all for coming. I appreciate Dr. Blessman and her PowerPoint presentations. We're going to talk about this new technology along with testing and, some of the disparities around hospitals and what it looks like if you have to go, because there are some things that you can say to those providers when your loved ones are in the hospital, friends, neighbors. You don't have to, you can demand some things in the hospital. So, but we won't belabor the conversation, but we will have that conversation to let you know that you can be empowered through this. You don't necessarily have to just take what they're saying. And, it's deep, and it's on my mind and it's on my heart because I'm dealing with a situation, but we are going to talk about that next week along with this new technology. So I want to end with this. This technology is expensive and this wasn't created overnight, but the mere fact that this company can bring this kind of technology to the table at the price they're asking means there are people who know things that we don't know. And this signals that this virus is not over, not by a long shot. And the technology is getting, it's growing and it's evolving. It's getting sophisticated. So, just another way of letting you know that this virus is not going anywhere, although the pundits say different, right? So I know we hear it every day. I know you do. Oh, no virus or whatever they're trying to say. I don't know. This virus ain't going nowhere. Make sure you stay masked up. Make sure you have your biosafety protocols. Justin, thank you so much for the blog. It is wonderful. If you have not been on our website, please check out our website. We're at www.Auset-Isis.org. Visit our biosafety page. Get your biosafety protocols, products from us, please. Thank you. And wonderful evening. Thank you for coming. Thank you, Dr.
Thank you, everyone.
See you all next Tuesday.
It's so good to see everybody here. Thank you. Oh, Eddie Rose here, Marjorie, Felicia.
Yep. Sister Marjorie.
Yeah.
Keep us in your prayers. Keep my family in your prayers.
Yeah, mine's too.
Yes.
All of ours.
Most definitely. We need each other to survive. That's the
right.
truth.
That's right.
You're
I'm good.
welcome, Dr. Rogers. It's good to see you. If you haven't hung up, Dr. Rogers, it's good to see you tonight. I'll be reaching out.
Thank you, Michelle. Always appreciate you and Dr.
Yes,
Bless.
ma'am. We love you. You're
Thank you so
welcome. Prayers
much
are lifted for
for your
you.
prayers and blessings. Thank you.
Yes. Hey, Rashidas, thank you.
Good night, Michelle and
Hey, my sister
Patricia.
Patricia. Hey. I wanted to snatch one of them bottles of Skin Guard out your hand. I said, look at Miss Patricia. She about ready. Ooh,
Yeah, and
I
it's
love that picture. That's a
and
great
it
picture.
does feel like a glove. It's so smooth and soft on my hand.
Dr. Blessman, she said so smooth and soft on her.
Okay.
I'm glad.
Only the best for our community. Only the best.
Right.
Yeah.
Amen. Amen.
Yes. Make sure you use it, Miss Patricia.
I will, for sure.
All right.
Yeah.
Ooh, Dr. Blessman, thank you. That was a great presentation.
Thank you.
Good night, everybody.
Good night.
Good
night, everyone.
Good night. Christy, I'm gonna call in the morning.
Okay.
Okay. Justin, you all right?
I'm good.
Thank you.
Hype City. I'm good.
Okay, yeah, I'm ready, trying to get ready for next week. I said, oh, let me queue up Q Health. Like, what is that?
Girl, when I seen that, I was like, I didn't want to forget about it.
Are we talking about like George Jetson? Oh, that's kind of old now.
Right?
Like, whoa.
Yes, honey. No more
Okay.
lab. No more. If you can afford it, no more LabCorp.
Oh wow. It's like that.
Yes.
Okay, it's like a breath of. I gotta look it up.
You gotta look at it. Yeah, you gotta study it. It's neat.
Yeah, I got it. Okay. So, thank you for. That's what I love about this group and the people in our group. Everybody here is just so knowledgeable. They bring stuff to the table that.
Yes.
And in doing so, it just really enriches the experience for everyone.
Yes.
And me too.
Me,
because
yes.
The Bible says, as iron sharpens iron, so does one man sharpen another.
Yes.
Amen.
So I'm loving the sharpening that's happening here.
Oh, right.
Okay.
I know I was like, wow, okay, that's good. I need to get the grandbaby son. We got a trip to Los Angeles in September, and I was thinking about them and their biosafety protocols. I'm like, oh my God, what am I gonna do with this wild crew?
Girl, that $12.99. I'm like, oh,
yes,
okay.
I can. That's good, right?
Because what I saw was like $24, $25, whatever. I'm like, I can.
Right.
Let me do this.
Right.
Okay.
Right. They take out something, getting ready to bite into my savings with that 25. All the people he knew. Yeah, I get it.
Right. Well, once you start, if you want to do this for all of the, elders. I mean, if we talk 10 people.
Oh yeah. Even still, that's a little pricey.
120 versus 250.
250. Yeah.
Right. That's a bite.
So that's cute.
Right. Okay.
All right, doctor.
Okay. All right, folks. I will
I'll see you in the morning.
See you in tomorrow.
Yep.
Hi, team.
Good night, Justin. Thank you.
Justin. Thank you for the blog. That was wonderful. Thank you.
Yes, that blog was awesome.
More stuff on the way.
Of course.
Wait.
Good night.
All right. Take care, everyone. Good night, team. Love you guys.
Love you too.
I got the best team. All right. Good night.
Good night.